And, I think of you because of, the vagus nerve, and I've learned so much about the vagus nerve. I had Neil Nathan, I interviewed him. I don't know if you've had him on the podcast, but he's an
I haven't.
incredible medical doctor, speaking about mast cell activation syndrome, speaking about just the vagus system, speaking about the limbic system. He's got a brilliant book, the patient's guide to healing, sensitive patient's guide to healing. Incredible book. And he puts these experts in, but we're just talking about just treating the vagus nerve in the cervical spine, treating the vagus nerve and its relation to the head and neck and the TMJ, and having just looking at the alignment and how important that is. So you treat IBS, you treat gut, you treat IBD, you give supplements, you do procedures, and actually it's all coming from this hypersensitivity and irritability on the vagus nerve. There are a million causes there with the vagus nerve, but I've had so many patients come from functional medicine doctors, and I'm talking hundreds, if not thousands, I could be mistaken on the thousands, but that I do injections to the cervical spine, and we correct the structure. The vagus nerve absolutely gets some stability. It doesn't become so sensitized, and we reduce the central sensitization, and the stomach issues go, the gut issues go, the IBS goes, the anxiety goes, and then we track this vagus nerve, and we use injection therapy, and we use ozone and injecting ozone and running ozone drips and hydrogen peroxide, and then we treat this vagus nerve, and the heart rate variability improves. So they've been 5 years, 7 years, sometimes 10 years trying to improve heart rate variability with breath work and nutrition and seeing a functional medicine doc and grounding, and they're getting sunlight. And then after 2-3 sessions in the cervical spine, we absolutely changed their whole neural system. And that blew my mind to such a large degree that the structure there can have such a big impact on the entire body.
It absolutely can. Yes. And it's so interesting you say that, because we're 80 to 90% virtual, which means that what I can do physically for patients is very limited. And so the things we've shared with people over the years, first of all, Jim Laird, our strength and conditioning coach, has a world of knowledge about this topic, because he's been through, quite a journey. We've covered that on the podcast. We've got another episode with him coming up. He was very much that switched on person, can't shut off. And he's constantly explaining to patients, it's really hard when you're stuck in that mode and you've been stuck in that mode to get unstuck from that mode. And sometimes it is best, we've certainly found, to do something like you're discussing, but we don't have a lot of skilled operators who can do what you're talking about all over the world, right? It's a pretty rare skill set, I would say. And so what we've found that's helpful is, first of all, most people's breathing mechanics are not optimized, and they're not even close to optimized. I'm curious how much you spend of your time going over respiratory rate data. But when we see a respiratory rate in the practice that's 15, 16, 17, let alone 19 or 20, we know that person is revved up, and we know that we can bring them down and help them relax, because optimized to us is really more of a 12 to 14 respiratory rate. And that's a certain amount of breath work, but then the supplements sometimes have a significant impact. And then as well, things like float tank, where you have to stop, you have to rest. And also, Jim has pointed this out to me, that it forces your skeleton into a different position, because you're lying there for up to an hour or more in the float tank, and your body relaxes, and your rib cage and your pelvis can get into the proper alignment, which can have a very profound impact on the nervous system. I've seen my HRV double after float tank sessions. Amazing. So, and it's so important, because we'll get people on a weekly schedule if they're open to it and they have the time. And all of a sudden, a lot of the things that they've been doing for a long time that weren't working will suddenly take, because their nervous system is ready to actually incorporate the changes.
Incredible. Now, breath work is a big part of my coaches that use it. We look at that. So then you've got breath work. At the same time, we're using infrared over the head and neck, which has been incredible. Then we're using a product called Apollo by Dr. David Rabin. You should have him on your podcast. Absolutely incredible. Then it's Dr. Patrick Porter's work on brain tap. That's a huge part of my practice, especially my corporate executives, and having a look at changing the brain state. So these people that are in beta or high beta, and then dropping them down into alpha and theta, Brain Tap has been the number one most friendly user modality that we use, because it goes everywhere. When you travel, you can do it at night, you can do it in the morning. Apollo is also very, very good for teenagers, adolescents, children. You can just strap it on, sends a frequency, helps that heart rate variability, just drops that cortisol and that adrenaline. So there's a lot of these modalities. If I just think of the patient that recently came to me, who was having such anxiety, had been on multiple antidepressants, anti-anxieties. We used infrared, we used prototherapy into the neck and the jaw, we used the Apollo, we used Brain Tap, we used hyperbaric, and we run in a hydrogen peroxide drip and a hydrogen peroxide nebulization, because, and I can tell you, the hydrogen peroxide nebulization has helped so many people with their breath work, so many people with their nasal passages, and it is so important for the nervous system in this area. Put that all together, 3 months later, this person who was really, really struggling with anxiety is now anxiety-free, off their medications, has done exceptionally well. So this is multi-modality, multi-use, coming from different angles to use different things, and very, very powerful.